If you have staircase in your house, that's all you need. Go up and down the stairs in your house several times for like 30 minutes to an hour till your heart is pumping, till you're sweating. You have done your exercise for the day. Okay?
I was down with an illusion.
Alright guys, welcome back to my channel. If you are new, if this is your very first time finding this channel, thank you so much. My name is Andy. I am a family nurse practitioner. I make video content about health and healthy lifestyle. So if that's something that you like, you are in the right place. Come on, let's talk, let's chill, let's learn together. All right, so in today's video we are going to be talking about chronic kidney disease, also known as chronic kidney failure. So let's go. All right, so what is chronic kidney failure? It is the gradual loss of kidney function. Okay, when your kidneys slowly lose function. So kidney filters waste products and excess fluids from the body. That's the function of our kidney. Okay, it removes the everything that you've eaten, everything that is bad, that is waste in your body. It filters it through something called glomeruli. That's the filtrating system of the kidney. So it functions, it filters the waste out of the body through that, and it is removed through the urine. Okay, so it filters waste product, goes into the urine, excreted out of the body. So problems with kidney begins when your kidney is not able to remove waste products anymore from the body, or when it begins to lose function, or when the filtrating system of the kidney begins to lose function and it cannot filter things as it should. So at first you might not notice anything, but if it's not taken care of, it can progress to what we call end-stage kidney disease, which can eventually lead to person being on dialysis, and that's not fun. All right, so what are the causes of kidney dysfunction? What are the things that would cause the kidney not to work well? Diabetes type 1 and 2. We've talked about that in this channel. I just did a video recently on diabetes type 1 and 2. If you've not watched it, I'm going to link them both to this video so that you can watch them. Watch it, because if you don't get your blood sugar under control, it's gonna slowly destroy the filtrating system in the kidney, in the filtering system in the kidney, and it's going to gradually cause the kidney to lose function. All right, the second thing is high blood pressure. As usual, if your blood pressure is too high, is uncontrolled, it's going to cause kidney to lose its function. Something called polycystic kidney disease or other autoimmune disease. Another one is glomeruli nephritis. That is just inflammation in the glomeruli of the kidney. What is the glomeruli of the kidney? It is the filtering system of the kidney. It's where the kidney filters waste product. So if there is constant inflammation in that area, it might lead to that filtering system being destroyed or losing its function. Having prolonged or untreated urinary tract infection, otherwise known as UTI. This is usually due to enlarged prostate. So for men that have enlarged prostate, or BPH, also known as benign prostate hypertrophy. If you are one of those and you keep having chronic UTIs, it can lead to kidney dysfunction. Another thing is kidney stones or other forms of cancer. It can cause the kidney to be destroyed. Another one that can cause kidney disease is polynephritis, which is the recurrent kidney infections. If you keep having infections in your kidney, it can lead to kidney dysfunction. Now let's talk about the signs and symptoms of kidney disease. Okay, so the thing is that kidney disease develops over time. So the signs and the symptoms can mimic other things, or it can be very subtle that people usually don't catch it on time. So you may not notice it at first. An example is nausea, vomiting, fatigue, loss of appetite. That's a classic signs and symptoms of so many other things, common thing like pregnancy. So in a woman, especially in a childbearing age, that might be very confusing. So that's why at first people might not know that that's what's going on with them. Another thing is urinating too much or too less can be a sign of kidney dysfunction. Being disoriented or not being as sharp as you used to be could be a sign of kidney dysfunction. Muscle cramps, swelling in your hands and feet, dry, itchy skin, high blood pressure, shortness of breath, chest pain. All of that can be a sign of kidney dysfunction. Remember that your kidneys filters waste products from your body. If they're not able to do it, those things will be retained, which can cause excess fluid in your body, and that's where the swelling in your hands and your feet come from. Risk factors. Let's talk about risk factors. Risk factors for kidney disease include, again, diabetes mellitus, high blood pressure, smoking. Those things are all correlated. Remember when we talked about type 1 diabetes and type 2 diabetes? Again, if you haven't watched that video, I will really encourage you to go watch it. I will encourage you to go watch it. So diabetes, high blood pressure, smoking, all of that is also risk factor for kidney disease. Remember that complications in diabetes is kidney disease. So if you're not taking care of yourself, if you're not keeping your blood sugar under control, if you don't quit smoking, all of that can lead to kidney disease. Being obese, so obesity, being black or African American, and also being being a Native American is a risk factor for chronic kidney disease. Alcohol. Okay, I'm going to pause right here and have a little bit conversation on this. So alcohol, what does the kidney do again? The kidney filters out waste products from our body. When you drink alcohol, alcohol slowly, not immediately, slowly and over time, destroys the glomeruli of the kidney, again, which is the filtering system in the kidney. So another thing that alcohol does is that it dries out the body. Okay, it dries out the body, so it makes you to be dehydrated. If you're someone that drinks alcohol, tell me this, and you can notice this, that sometimes when you finish drinking alcohol, your mouth gets really dry and you get thirsty. That's because alcohol dehydrates the body, which is very important that you hydrate. You drink lots of water when you drink alcohol. When you are dehydrated, that affects the glomeruli of your kidney. Okay, it affects your kidney function. It causes your kidney to be less functional. It destroys that filtering system, so over time your kidney is not able to filter as it should filter waste products from your body as it should filter. Now, let's now go into complications of kidney disease. Complication includes fluid retention. So remember when I said that if your kidney is not able to filter out waste products from your body, it gets retained in your body and it becomes toxic. Okay, it stays there because it's not removed. It causes swelling. All that fluids will cause swelling in your arms, will cause swelling in your legs, and even in your lungs. Okay, and it will cause your blood pressure to go up. Another thing is that it causes the potassium level in your body to increase, which impairs your heart function, and it's very, very, very life-threatening. Anemia. If you're having kidney disease, you don't have functioning and healthy red blood cells. What does red blood cells do? It helps us transport oxygen to our cells and our tissues. If you don't have enough red blood cells, it's going to lead to anemia. If you haven't checked B12 deficiency anemia, what are you doing? What is your problem? What do you want from me? How do you want me to help you? Honey, click the link. Just click the link up here. Okay, I'm going to link it up here. Click and watch. This is free. Subscription is free. Okay, watching is free. So empower yourself by being knowledgeable in these things. Alright, so the next complication is pericarditis. So pericarditis is inflammation in your pericardium. Your pericardium is the sac that covers your heart. It's the protection in your heart. So when you have inflammation there, okay, it of course is not able to protect your heart as it should. So that's another complication of kidney disease. Another one is heart disease. Again, anemia, elevated potassium, all of that is all linked together. It's going to cause heart disease. So how do you prevent, my people, how do you prevent this from happening? Like everything that I have told you, the number one way is always maintaining a healthy lifestyle. So you want to eat well, you want to exercise, and I'm preaching to myself when I talk about this exercise business, because the struggle is real. So you want to make sure that you're exercising, especially with everything that is going on in the world right now. People are not able to go out to the gym as they should, but you have staircases. If you have staircases in your house, that's all you need. Go up and down the stairs in your house several times for like 30 minutes to an hour till your heart is pumping, till you're sweating. You have done your exercise for the day. Okay, so make sure that you do that. Quit smoking. If you're smoking, make sure that you quit smoking, because I have talked so many times. I have talked about smoking. Okay, type 1 diabetes, type 2 diabetes, I talked about smoking. So again, if you haven't, check those videos out. Watch out for over-the-counter medications that we check. So there's this group of medications called NSAIDs, non-steroidal anti-inflammatory medications. Okay, so NSAIDs are things like aspirin, naproxen, ibuprofen, Aleve, Motrin, that's the other name for ibuprofen. Those are things that are available over the counter. Those medications decrease your kidney function. They are toxic to your kidneys. So it's not that you don't take it, but limit how much you take it. Take it only when needed, because they decrease your kidney function. Decrease your alcohol intake, please, 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 especially my African guys. Decrease. We see so many young men now that are on dialysis. Some of them is not alcohol related, but a lot of them is related to too much drinking of alcohol. So make sure that you decrease how much alcohol you drink. It's not going to destroy your kidney right away, but over time, if you keep doing it, it might lead to that. Make sure that you're drinking lots and lots of water, because water hydrates the body, hydrates your kidney, helps to filter the waste things out of your body. Now to the fun part, my tips for you. Now I always have tips for you in every video. So my tips for you in this video is, make sure that you keep all your appointments. That's always my number one. Make sure that you keep all your appointments with your provider. make sure that you know your body. It is important that you become intimate with your body so that when something is not right, when something doesn't feel right, when something is out of the way, you know. You will be the first to know when you're intimate with your body, okay? Make sure you know, because early detection can help prevent kidney failure. If it is found out on time, there are things you can do that can help prevent your kidney from being completely damaged, for getting into what we know as end-stage renal disease. When you get to this point, you need dialysis, and you have to go for dialysis 3 times a week to get out the waste product, the things that your body naturally does, the things that the kidney naturally does, which is filtering out waste products from your body. When your kidney is no longer functioning, you have to now utilize the help of a machine, which is the dialysis equipment, to get this waste product out of your body. Okay, so make sure that you know your body. Make sure that you take your medications as ordered. Anything that you want to take, whether it's over the counter or any dietary supplement that someone has recommended for you, always check with your provider to make sure that it is safe for you to take. All right, that's all I got for you guys today. Thank you so much. As always, don't forget to like, share, subscribe, comment, because again, it helps me and it helps YouTube recommend my videos. Thank you so much for everyone that has supported me. Happy New Year to everyone. Thank you again. Until next video. Bye.
I'm going out my mind. Give me some directions to get to you, to get to you.